I'm calling the meeting to order. Please rise. And Neil, will you lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the
United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yeah. Okay, we have 3 minutes to approve. And I will entertain a motion for at least to affirm the fact that we have non-public sealed minutes of the July 27th meeting.
I'll move to accept the minutes from the private sealed meeting.
Okay, Zach moves. Is there a second?
Second.
All right, I thought Marianne was signaling with a wave that she's, but that's, and Neil seconds. Marianne, your vote?
Aye.
Okay, Neil?
Aye.
Zach?
Aye.
John?
Aye.
Bill? Aye. Very good. That's fast. Next is July 27th work session meeting minutes. Is there a motion?
So move.
That was a John so moved. Is there a second?
Second.
Zach seconds. John, your vote.
Aye.
Oh, excuse me. Any discussion? Seeing John, your vote.
Aye.
Zach?
Aye.
Marianne?
Aye.
Neil?
Aye.
Bill? Aye. It is passed. And thirdly, the regular meeting minutes from July 27th. Is there a motion?
These are some of the longest ones we've had, but I will move to accept the July 27th meeting minutes.
Okay, Zach moves. Is there a second?
I'll
Second.
second.
Okay.
Oh.
Marianne can have it.
Yeah, Marianne. Yeah, Zach moves, Marianne seconds. Any discussion? Seeing none, Marianne, your vote.
Aye.
Neil,
Aye.
Bill, aye. Okay, the select board will meet on the following dates. We'll have regular meetings at 6 p.m. on Monday, August 24th, September 14th, and September 28th, 2020. Work session of the regular meeting will start at 5 p.m. All the above meetings will be held in the town hall unless otherwise posted, except for the fact that they're generally on Zoom. Citizens wishing to be listed on the select board's agenda should notify the town hall before 12 p.m. the Friday before the scheduled meeting. Reopening of town offices, keeping with the governor's new orders and after discussion with the Plymouth Emergency Management Director and the Plymouth Health Officer, the reopening of the town offices has been moved to August 24th, 2020. Town employees are still available to the public during regular business hours. Town employee still available. You can call to have your questions answered, to make an appointment with any office, or continue to email us at townhall@plymouth-nh.org. The Selectman's office is open Monday through Friday, 8 a.m. to 4:30 p.m. The number is 536-1731. Town Clerk's office is open Monday through Friday, 8:30 a.m. to 4 p.m. And Josie's number is 536-1732. Tax Collector's office is Tuesday through Thursday, 8 a.m. to 2 p.m. 536-4733. Thank you for your continued patience and support during this time. Chairman has no comments.
Bill, I have a quick question about the select board meeting schedule.
Yeah, sure.
Well, why is it that we have 3 weeks before meetings there? Is that to avoid Labor Day?
That-
Sorry.
The meetings are usually the second and fourth Monday of every month. If one of the meetings falls on a holiday, then it's usually held the day after. Some months have 5 weeks in them, and sometimes we do, like in the 5th week, set up a work session, tentative work session, if the board wants to meet that week so that we don't have 3 weeks in between. If we do have a 5th week that we're going to have 3 weeks between meetings and the board chooses to meet, then just let me know and we'll set that meeting up.
Okay.
And I want to take up the Josie Garona and Bob Clay regarding elections.
Great. Thanks, Bill. Bob, did you want me to begin or?
Go ahead and start.
All right. Great. So first off, we just want to thank you for meeting with the moderator, Bob Clay, and I tonight. We'll try to keep this brief because we know you have a long meeting ahead of you. First off, we of what who choose to not wear a mask will not be allowed inside the school building. Those individuals will have the option to register to vote and vote absentee outside of the school building. The Secretary of State's office will be providing PPE to municipalities. Poll workers will be required to wear either a face shield or a N95 mask and gloves. Table shields will be provided as well, and voters will be provided with a disposable pen, paper mat, and folder. Before moving forward, did the board have any questions about the polling site on Election Day?
Any questions? I guess not.
Okay. So Bob and I wanted to meet with you guys to discuss some things regarding elections. Due to the COVID-19 pandemic, most of our senior poll workers are unable to work on Election Day. Thankfully, a younger generation of residents have stepped up and are willing to serve as poll workers. Typically, in the past, the select board members have chosen shifts to work. However, this year, the moderator, supervisors of the checklist, and I are requesting that board members be present during the entire day and to provide support where the moderator sees fit on Election Day. So we just wanted to let you know that now.
That is an RSA, by the way, that we have not followed, and I've got my head in the hammer
Yep.
every time, every election. But I've always been able to fight it off. I don't think I'm going to be able to this time.
Yeah, we definitely need all hands on deck. It's going to look very different this year because even though we'll have the polling site inside the school still, we'll in a sense be duplicating it outside. So we're going to need more support, more people, and definitely the select board, will need your help.
So the process that's going to happen is that anybody who comes, there will be a tent outside that if they are on the checklist and a registered voter and wearing a mask, they'll be directed inside to the correct line with proper spacing and so forth. If they're outside and they refuse to wear a mask to go in and vote, then we will provide a voting tent outside where they can fill out the absentee registration, vote. There will be a ballot box outside that ballot will be put in and brought inside and processed later on during the day, so that everybody will be entitled to vote. Nobody will be disenfranchised from the right to vote, but it may not be the convenient way that they want to vote. Because of that, I think we're going to need extra police coverage, that I'm going to need to have a police officer outside and hopefully a selectman or two outside, that if there's a constituent that that is being belligerent, that maybe you can help us to prevent issues from being created. The polling place is going to be set up different inside. It's going to be just reverse. People are going to come in one door and go out a separate door. So there's one-way traffic. We are taking into consideration everything the state has said. We have been meeting with the Secretary of State's office. I've now had 3 Zoom calls. I'm meeting every Thursday morning at 9 o'clock as more information comes forward. But we are prepared, but it's going to be an expensive election because of the people we need to have. I strongly encourage every one of you to tell every one of your friends to vote absentee.
Yes. Yeah.
There will be an absentee process where we will do the first phase of the absentee on the Monday before the election, where we'll open the first envelope and highlight on the checklist the people who have submitted their ballot, so that it's a quicker process the day of the election, where we will just open the inside envelope, check them off, mark AV, and cast the ballot. Right now, the state is, I want to say the last number I had was at 16% for absentee ballots, and they're figuring it could go as high as 50%. The other issue that I have to deal with are new registrants from the college, because this is what happens all the time. We are doing all we can to register people ahead of time, and we will have to have provisions there to register new people. It could get rather hectic even if we have 50% of the voters that we normally have. So I'm asking for some extra police help. We're going to have tents outside. We have that volunteered by Steve Rand, has given us the tents. I would like to have as many of the town people, town employees that could work there as possible. If we could have firefighters that are on call maybe, that may have to leave, that could help with guiding people or directing people. I just need people desperately.
Yeah, and to add to Bob's point about as many people requesting absentee ballots and registering to vote prior to Election Day, we are working on having absentee ballot request drives as well as a voter registration drive. And I'm currently working with the university right now. Hopefully, we may have something in the future on campus for students to register to vote, so we're not overwhelmed by large crowds on Election Day. So that's something that's in progress right now.
But I thought it was really important to keep you abreast of what's going on. We will continue to have Thursday morning meetings. We're waiting for some rulings from the Attorney General's office on things that we can and cannot do. So stay tuned. We'll keep you informed as more information comes. But supposedly the new manual is at the printers right now and should be available to us within the next 2 or 3 days.
Yep.
So, any questions?
I have one quick question. Just so that I'm 100% clear, this is all in regards to the federal election and not the state election on September 8th?
No, it's both.
Okay, so both so you're looking for us to be there all day, both days?
Yes.
And for
Yes.
the
The RSA calls for any election in the town for all selectmen to be there. In the past, we've allowed one person to be scheduled with different shifts. And as I said, every time I get written up by this Attorney General's office for not following the law.
Yes, no, that makes perfect sense. I just wanted to be sure we were talking about one or both or exactly what was being discussed.
And again in March.
Again in March, right.
And then I retire. So start looking for somebody to replace me.
Bob, is there any change on the domicile rule, or is it?
No, the only thing that has changed, and it's confusing for people, Josie can explain it better, but there is something that says that you have to register your car within X amount of time if you register to vote in the town.
Yeah.
That's the Attorney
Within
General's
60
office
days.
to follow. That's up to the Attorney General's office to follow through on that. And we cannot deny them the opportunity to vote, whether they do that or do not do that.
Yeah, absolutely. There's no enforcement on our end on whether if someone comes to register to vote, that they have to thereafter get a New Hampshire driver's license, that is up to them. That's their independent decision to make that appointment with the DMV. And that Bob said it correctly, that the AG's office would then follow up with those people. But every resident who wishes to vote in this election, whether it be a PSU student, homeless, visiting nurse, traveling nurse, I should say, everyone has the opportunity to vote. That is New Hampshire state law.
And on that note, I want to thank you both, and I'm going to break away now for a public hearing.
Good luck.
Okay, thank you very much, everyone.
Bye,
Thanks,
Bob.
Leslie.
Bye-bye.
I'm going to open the public hearing. It's 6:15 still on 8/10/2020. The Plymouth Select Board welcomes all present for this, the public hearing on a proposed mask ordinance for the town of Plymouth. Regarding a comment that with the last public hearing, there were several issues that were identified that, would not be very compatible with people eating in a restaurant or mowing their lawn, or, some of these things were obvious that they had to be corrected. We met with our attorney to clarify some of the language, and the new hearing is what you've found online and we'll be commenting on. So to open it, I'm going to read correspondence from Michelle McEwen, who's the Spear Memorial Hospital Administrator. And she states, or she starts, "Dear members of the Plymouth Select Board, we are writing to express our support of the town's proposed mask ordinance to be voted upon August 10th. To date, New Hampshire in general and Central New Hampshire in particular have been spared from a surge of COVID-19 positive cases. This is most likely due to New Hampshire's diligence in getting out ahead of the pandemic with its multiple stay-at-home actions. Although these actions spared us from a surge this spring and more needless deaths, it did present significant economic challenges for our residents and businesses. State and federal relief have helped, but cannot repair all the damage that has occurred. As we watch what is occurring across the country, with over 30 states now seeing a rise in the number of new cases and numerous hospitals filled to capacity, we want to ensure that New Hampshire can avoid a situation such as this. Dr. Benjamin Chan, state epidemiologist, reported this week that New Hampshire is seeing an increase in the average daily number of new cases. This is most likely due to the increase of individuals in New Hampshire enjoying all that New Hampshire has to offer. Our state schools, colleges, and universities will soon be opening, presenting higher risk for more new cases. We have seen many states and numerous New Hampshire towns and cities adopt mask requirements to help support safer communities that benefit all residents. For the sake of keeping our residents, students, and visitors safe while moving our economy forward, Spear Memorial Hospital encourages everyone in our community to do the right thing to minimize the spread of COVID-19, which includes wearing masks, social distancing, and hand hygiene. To this end, we heartily support the proposed mask ordinance brought before the town. Thank you for your support of our medical community and efforts to keep our community safe while strengthening our economy. As the town makes its decision about proposed ordinance or has other medical concerns about COVID-19, please know that Spear is ready for your help." And that's signed by Patrick Miller, the board chair, and Michelle McEwen, the president and CEO. And that being read, I just want to make a statement that we're going to take public comment. We're going to limit it to 3 minutes. I want everyone to state their name and the town you are from. And we'll have 3 components to this. The first is we'll hear from Plymouth residents who did not have an opportunity to speak at the first public hearing on July 27th. And after that, the board will hear from other Plymouth residents that have spoken before and have new comments to make. And lastly, the board will hear from other persons who have not spoken. So therefore, I'm opening the hearing to any Plymouth residents who did not have an opportunity to speak at the first hearing. And there is no chat on this, and you'll have to raise your hand either at the bottom under, I guess, reactions, or on, yeah, where else? Oh, under participants. And then there's a button for raise hand. So now open.
At the bottom of your screen, under participants. Yeah.
Is there another page, or is okay? Is there anyone who has not made comments at the first public hearing that wants to speak?
I see
Okay.
hands, one hand, Michael Kadea.
Oh, Cuddly.
Cuddy, in the house. Just wanted to speak up quickly. I wasn't present in the room. I was spectating on the first meeting. Just wanted to speak my support quickly. I think that the main reason that our area is continuing to stay out ahead of the virus is because we are being diligent and we are continuing to do the work and practice social distancing. I think it's mission critical right now, before the university returns and before schools are back in session, for us to definitively take a stance as a town and just show solidarity that we are putting public health before our own partisan interests. This is bigger than red or blue. This is about public health and about public safety, and we need to keep that at the forefront before anything else. Full stop. I pass the mic to whomever else.
Thank you, Michael.
The next one I have is Jenny Tebow.
You know how to pronounce that.
Yeah, but she's kind of spelled it wrong.
Yeah. Really,
Jenny,
Ann?
Blocked.
Come on now.
I know,
I'm
you're
trying to
up,
make it
you're
easy
up.
for you.
Sorry.
Okay, so Jenny Tebow from Plymouth. The question that I had is one that was raised by David LaRue and Micah, I don't remember his last name, how it affects outdoor work. I didn't see it specifically mentioned in the revised, but like if there's a workforce of guys working at a landscaping site and they're outside, even if they're within 6 feet of each other, are they going to be required to wear a mask? Obviously, if they're out separate from 6 feet of each other.
So that seems to be addressed in number
My
3.
connection is unstable.
Sorry, you're still talking. So that does
Sorry.
seem.
Yeah.
So it seems like number 3 kind of addresses that, the face coverings.
Oh, okay.
What's that?
Okay. Okay. I just didn't see it.
Oh, okay. Sorry.
Where was it?
Good question, Jenny.
All right, the next person I believe I have.
Well,
here-
and yeah.
Sorry,
About outdoor public.
Yeah,
Jenny, are you still up?
Because you have to,
I'm just trying to.
it was different on the original.
You're good?
Because that
Sorry.
was my question. I didn't. I see that. I
The
saw
next
that.
person is Kayla Welch.
Hi, everyone. My name's Kyla Welch. I'm the SAU 48 superintendent. So nice to meet all of you on the select board tonight. I just had one quick request. We did not have our board meetings during the last mask hearing, so I just wanted to ask if the board does vote to approve a mask ordinance tonight, that you kindly request considering allowing Plymouth Elementary School and Plymouth Regional High School to follow their mask protocols they have already approved by both school boards. And they are following both the CDC guidelines. They have exceeded the New Hampshire reopening guidelines, which we are requiring masks with frequent mask breaks. But we have sports and co-curriculars where we're following NHIAA guidelines and the New Hampshire youth sports guidelines as well. So I just wanted to make that statement on behalf of both districts tonight. Thank you.
Thanks, Kyla. Hey, so where are those, Zach, are you aware of those changes? Do we have copies of them, or?
Yeah, so both have been posted on both on the school's website. So
Yeah.
I've seen both. I don't know as there's necessarily anything in our proposed policy that's directly in conflict with their policies. The one area that is probably could be interpreted as out of sync is that they do, both the high school and the elementary school have mask breaks included in what they're talking about. We don't explicitly have anything about that in the ordinance. So I don't know if we might choose to put some amended language somewhere in here to address that.
Could we make a statement?
All students to wear masks?
Yes, we are requiring all students, staff, and visitors to wear masks. And then there will be mask breaks at times, both inside and outside.
Your policies do have exceptions for medical reasons, though.
Yes,
I'd like to,
absolutely.
Ask
So the age
something.
doesn't matter?
Age doesn't matter. There will be exceptions for certain students with disabilities and medical exemptions.
Can we put a clause in that the school's policies will supersede the town policy?
Yeah, Bill, did you get my most recent email where I did add something in there based on Kyla's email or letter to us?
So I didn't look at it. What's the what did your email state?
Basically under number 7, it added that Plymouth Regional High School and Plymouth Elementary School would follow more stringent protocols as approved by both school boards and written in their specific reopening plans. The schools are allowed to set more stringent guidelines.
Okay.
Is that
Right.
acceptable?
I might go with some language that sort of gave them the ability to set their guidelines in their building sort of generally, so that we weren't making interpretations between which was or was not more stringent. That would be my recommendation. Is just get a line in there that says Plymouth Elementary School and Penny Baker Regional High School have policies in effect that will supersede the recommendations on the ordinance.
But wouldn't they have to be more stringent?
Well, so they have some light exceptions that aren't, right? Like they're allowing mask breaks at their desk while nobody's moving, and the distance isn't quite 6 feet, but I think given the size of the classrooms and those sorts of things, that policy is pretty well considered at this point. And I would hate for us to put something in place to kind of put them back to square one.
Okay. Is there a motion to accept that amendment to the policy? To the ordinance?
So moved.
All right. Neil moves. Is there a second?
Second.
All right. John seconds. Zach, your vote?
Aye.
Any discussion? Excuse me. Seeing none, Zach, your vote?
Aye.
Still aye, huh? Neil?
Aye.
Mary Ann?
Just froze.
She's frozen.
She's contemplating. John?
Aye.
Bill? Aye. Okay, the ayes have it. All right.
So the next person I'm seeing, I don't see anybody else who did not speak from the last public hearing. So the board's willing to take a second round of comments? Yes?
Yep.
Okay. The first one is Karen McLeod.
Karen McLeod. I am a Plymouth resident. I do want to echo Michael Cudahy's sentiments and Michelle McEwen from the hospital. And I'd like to thank the board for revisiting this and reworking the ordinance. And I totally support the ordinance. I would like to see us basically be in tandem with the with the public schools in our town, but I'll take masking up as a win. So I encourage you to support the ordinance. Thank you.
Thank you, Karen.
Is there any other Plymouth resident that wanted to speak? Karen Valentini, are you from Plymouth?
Hi, Chris Valenti. Yep, I'm in Plymouth. I spoke last week and just wanted to speak again to ask for clarification for the verbiage regarding businesses, specifically dealing with fitness. Looking at the governor's guidelines, the stay-at-home 2.0 came out in June 15th. He allows masks to not be worn and if there are any strenuous activities. So some kind of clarification to our ordinance, I think, would be helpful. So, you know, any places that people are working out and it's too much, you know, to wear the mask. I can send the document over. It's called, you know, the COVID-19 reopening guidance. He's got one for health and fitness facilities, and it's like a 5-page document. And number 5, they go into what to say, you know, to set that up. You know, so if someone's not actively engaged in a workout where a face covering can make it difficult to breathe, the face mask's not required. Because as the ordinance stands right now, anybody going into any business needs to wear the mask. So I'm just asking for some clarification and some update.
So did you state that correctly? Like, you know, if they're, you know, not exercising, then they wear a mask?
Yep.
Or...
So the governor has a pretty, or the governor's paperwork says all staff and members must wear a reusable, washable cloth face covering over their nose and mouth when in the facility and not actively engaged in workout where a face covering can make it difficult to breathe. So, you know, when you walk in the facility, you're wearing the mask. When you're stretching, you wear the mask. But when you're doing something where your heart rate's elevated enough that, you know, it could really be uncomfortable and make it difficult to breathe, and we don't have to do it for, don't have to wear it for strenuous activity. Also, in this situation, the people would be socially distanced 8 to 10 feet. So if you're
Lost her. I didn't do it. All right, so we'll come back to Kristen. The next.
I don't have a raised hand, but can I throw my name on the list to chat?
Are you from Plymouth?
I am, yes.
Kim, you're up.
Oh, okay, sorry. Thank you so much. So I've lived in Plymouth about 2.5 years. We love it here. I just wanted to express, I don't necessarily, I guess I don't support the ordinance. I agree with the science. We wear masks where we go. I'm not against that by any means. I'm just curious about the numbers of active cases that we have in Plymouth. I think WNUR had 0 today in the most recent list. And I also think that the university...
Sorry, there we go. Am I back on?
No, hold on. Kristen, we'll come back to you.
So I was just going to say, I think that the university has a pretty solid plan for the students. I was also concerned about that. I have 3 young kids.
Am I back on?
And so that's just, and my other concern was what kind of support the law enforcement's going to get in terms of working, as I think I was watching before when you guys were asking for their help for the election, and then in support in enforcing the ordinance, and then in also coordinating when the students come back. So I think those are my main concerns is in that ordinance. I respectfully wear a mask when we go into businesses. I'm okay with that. I just wonder if the town-wide ordinance is just warranted or needed, given the cases that we've had, the history of the cases that we've had in Plymouth, and with the town, with the businesses, you know, people adhering to the businesses' requests as well. That's just my thought. But thank you so much.
Thank you. All right, so let's see. Did she come back? I don't think she
but now,
All right, so Magnus S., are you from Plymouth?
Yes, I am. I am a Plymouth resident of 2 years now.
Thank you. You're up.
So I spoke at the previous meeting in favor of the mask ordinance, and I just want to reiterate that I believe strongly in this. As you know, some people, while some businesses are saying, yes, we would like you to wear masks, people are still ignoring that requirement because there is no mandate basically stating as a town as a whole to protect our individual people, we need you to be wearing a mask. So as a result of that, we're getting a mishmash of we want people to wear masks, but because there's no ordinance, there's no strong reinforcement to that where people willingly are going into business masked up because the town is now saying, if you are going to be here, we would like you to wear a mask in any business that you're going to be going into. Like, yes, take the mask off when you get outside. That's fine. I don't mind that at all. If that's what you feel you want to do, as soon as you hit the door, go right ahead. But I would prefer that people be masked up when they go to a business, when they go into a place where there are copious amounts of individuals in one area where, yes, we can try and social distance, but it's still difficult. That mask is a safeguard still, because again, I'm not masking up to just protect me. I'm masking up to protect individuals that are around me. It's to protect everybody else. And it's not, political. It's not red, blue. It's not anything like that. I'd like to also support that commentary. It's about us as human beings caring about other human beings. That's all this whole thing is we're here to care about one another as humans. Putting on a mask is basically that. And if you don't put on a mask, you don't care about your fellow human beings. That's basically the gist of it. That's all I've got. Thanks, guys.
Thank you.
Thank you. Britt's phone, are you from Plymouth?
I am Britt McDonald. I'm here in Plymouth. I'm a Plymouth resident. So let me start by saying I am pro-mask. I'm just not pro this ordinance. And here's the reason why. So I'm a healthcare provider here in Plymouth. I work at Plymouth OBGYN, speaking for myself, not for Spear. My big concern is threefold. The first off is, as a women's healthcare worker, I do have patients who are unable to wear masks because history of trauma and abuse, who have panic and PTSD associated with wearing masks. It is a very small group, but they do exist. I will tell you that as a provider. Requiring a doctor's note is very problematic. The first off is that there is some data on who shouldn't be wearing masks, but it's still a pretty subjective discussion about, if you have asthma, do you wear masks? If you have COPD, do you wear masks? There are some people who are absolutely not. In my situation, I'm in essence, what you're asking is for young women who have history of trauma, who have a hard time wearing masks, to come to me as their OBGYN provider and say, I have this trauma, I have this history, wearing masks gives me anxiety, and I have to say, stay home or present a note. And sometimes, to some extent, and I have had this happen already, there's a little bit of re-victimization that goes on with having to pull out a note every single time and say, I can't wear a mask because of my panic attacks. I can't wear it. No, that's not necessarily an acceptable. It puts me in a very difficult situation as a provider. The second thing I will tell you is that as a provider, I have two issues. On ordinance number 5 is that ordinance number 5 says that in a residence, if you have a group of people together, so if I have a play date over, if I have my neighbors over and my neighbors' kids are with me, then I'm in a situation where, according to article number 5, the kids have to be masked if they're over the age of 5. And if they're not masked, I can be fined. And the third thing I have is, as far as I read this ordinance, it makes it so that if I coach soccer, I coach for Plymouth Elementary School soccer, and I have 6th, 7th, and 8th graders, that I can't coach them outside if they're not wearing masks. And I can't ask 6th, 7th, and 8th graders to wear masks while they're playing soccer. So I have no problem with wearing masks inside. I believe there should be an ordinance to say when you go into the grocery store, those kinds of things, you should have to wear it. But the details of the ordinance are very problematic to me. The doctor's note, it's going to really bog down offices and have providers making subjective calls about who should and shouldn't be wearing. Definitely the re-victimization of some of my sexual assault survivors. And then once again, what people do in their own homes, their residents, who they invite in, the friends that they have over. The ordinance is a little broad under number 5 as to whether or not that's allowed or whether people could be fined for having their neighbors over and their kids interacting at less than 6 feet. So I do have a problem with that. I also think that there's new data coming out about 3 feet versus 6 feet. And I don't think that should necessarily be incorporated in because that's still very early data. But I just have an issue with the broad scope of the actual ordinance, and that's it.
All right. Is there any other Plymouth residents who wish to speak?
Yeah, I'd like to speak.
Ryan Sleeper?
Yes, ma'am. So I had a couple concerns around the ordinance. I guess, again, like someone else said, I'm pretty much pro-mask. I don't have an issue with masks. I have an issue with mandating it. I question how it will be enforced. And I question the necessity of it. I just don't understand like what the data is in Plymouth. I could see if we'd had like a massive amount of cases or even a decent amount of cases. Everywhere I go, I see people wearing masks. You go in a market basket, you have to have a mask. Walmart, you have to have a mask. I mean, everywhere I go, you have to have masks. I see people complying already. So I just don't really see the need for an ordinance. And further, I didn't understand why the town of Plymouth would be able, or was it you guys? Because I confused. I go over to Lebanon a lot, and they have it. If it can be extended past the state of emergency, which I thought was weird. If the state of emergency ends, then I would think the ordinance should end. But I kind of just don't see the need for an ordinance in town. And that's what I got.
Thank you, Ryan.
Thanks.
Any other Plymouth residents who wish to speak?
I'd like to speak.
Sarah, are you from Plymouth?
Thank you. I am a Plymouth resident.
Thank you.
So I have a couple of comments. One, I'm a little bit concerned. I support the mask ordinance. I'm a little bit concerned with the Plymouth University reopening. I'm seeing a fair amount of confusion among staff when they're getting tested and getting their results. The number of people that I follow on Facebook and I'm friends with, their results are coming back 4 to 5 to 7 to 9 days, or they don't know where they're supposed to get their results, or they didn't know that they were supposed to sign up for a Quest app and they can't get their results any other way. And the communication seems to be a little bit choppy between the people making the decisions and the people actually doing the things. Additionally, I understand that like Walmart has a mask mandate. I was in Walmart an hour ago and I saw 4 people walking around without masks. So they have a mandate. They say they're required, but plenty of people are still refusing and getting into the stores. And so I feel that an ordinance from the town would certainly help with those poor greeters at the front door that are very nicely asking several angry people to wear masks. So those are my comments. Thanks.
Thank you. Patrick Wetmore, did you need to speak? All right, you need to unmute yourself, Patrick.
You can hear me now, Kathy?
We can barely hear you, but if you get closer and speak up, we can hear you now.
You can hear me now. Okay.
We can.
Excellent. So I've noticed in the meetings so far, the last public hearing, as well as from, mostly the last meeting, that I know that there was citizenry on both sides of the issue that had questions, and I'm not aware of any public forum that's occurred for these questions to be answered. So I'm curious when and if those questions are going to be answered. I know that a whole bunch of communications, 70 or 80 communications have occurred that outside of the hearing, so via email and others putting them in writing. I'm sure those folks like myself had a lot of questions. I would just like to communicate that number one, freedom can be a fearful thing, and number two, when you have our fire and police chiefs who One is the public health officer, who at times has been excluded from this process, to include not being aware of a meeting back in April between, I know Chief LaFave was at it, and the university. I find that extremely alarming and concerning. I kind of cringe at the language that was used in the April 26th meeting, I believe it was, work session. I know Selectman Zach Tyrell referred to people making bad decisions, that these are bad decisions that people are making if they don't wear a mask. That being said, again, we can't legislate what someone deems as an arbiter of bad or good decisions. We can't micromanage those things. I believe that getting an abortion is a bad thing and a horrible decision. I'm sure there are those folks who would disagree with me on that issue. Another issue from that work session, Marianne was concerned about young folks congregating outside of her window and outside of her business on Main Street. All these concerns from April, I'm wondering if, the fear that was being communicated back in April, I'm wondering if we saw a spike in cases, because the way everybody was communicating fear, which I recognize that the Lord doesn't give us a spirit of fear, but a spirit of hope. And we can't allow fear to control us, but I'm wondering if we saw a spike because people were concerned. I remember she said specifically 22, 23-year-olds. There's a little bit of profiling maybe occurring there. So I'm just curious if we saw that spike with, folks not wearing masks and people on our board feeling like those folks not wearing them are making a bad decision. Those are assumptions made. I think there are people who suffer from medical anxieties and other issues. You might have children who are of the special needs community, if you will, who just can't have sensory issues. Like my little angel, he's not going to wear a mask. We're not going to make him wear a mask. It's not going to happen. So
We'll come back to you. All right, we're going to move on to the next person from Plymouth would be Micah. Micah Mickleborough, you need to unmute yourself.
How's that? Can you hear me?
I can hear you now.
Perfect. I just got onto the Zoom call, but here I am. I'm right here in front of the town office where apparently we can't walk in as Plymouth residents without a mask. I don't like that. I pay my taxes. My business brings an awful lot of revenue. And I'd rather everyone that, works for me doesn't end up in the hospital. I voiced this the last time. I don't like that Mr. Bolton and Mr. Tyrell and Mr. O'Neill are just basically, and there's a lady in there, I don't know what her name is off the top of my head, but I got CC'd an email that stayed from Steve Rand. I don't think he realized he was sending it to me, where he was talking to all of you select board members, not in a meeting. And I got told by Mr. Tyrell that in the last Zoom meeting that it's illegal for you to do that. So everything you're doing is illegal. And I pay taxes here, so I don't think any of you deserve to be on the select board. Not a damn one of you. You can get voted out just as easy as you got voted in. This is tyranny, what you're doing. If you think this is right, you are wrong. Everyone should have the freedom to choose. Everyone should be able to choose whether to wear a mask or not to wear a mask. You're afraid of the college? The college has the strongest mandate for masks. You might as well be in a prison cell if you come to PSU this year. But of course, you want to spread fear, lots of fear, all the time. That's it. We want to fight the fear. We are not afraid. None of us. We're all out here. We're protesting this mandate. There are actually more people out here right now than on this Zoom call. Are you kidding me? Look at this. Look at it. Come on out. There are more people on the common wanting freedom than are on this Zoom call. And plenty of them are Plymouth residents that pay taxes here. What do you think? When you're going to shut down the commerce for Plymouth because of all the surrounding towns, They come here to shop. We do business here. We are from here. And you know what? If you're afraid of the college and you think that you have so much power that you can shut down us, well, you don't. You don't. You can't. It's unconstitutional. We the people are telling the board of Plymouth that one, we will not comply. I certainly will not comply. And two,
Amen. Amen.
Yeah.
Thank you. Melinda, are you from
I'd like
Plymouth?
to clear the record.
I am.
Oh, sorry, Neil.
Yeah.
Hell no, you don't unmute me.
I never had any contact with Mr. Rand, and I haven't been in any.
I have. Go ahead, keep doing it. I have the email. You guys are liars. You liars. You're lying. I have that email.
Okay, Micah, it's my turn.
Well, it better be about freedom. You can.
Melinda?
Yes.
Go ahead.
I am a Plymouth resident of 8 years, and I work at the university. And we had a call last Friday for faculty and staff where we have gone over the process that the university is following. And yes, they've got a lot of mandates, but we've already had 3 students that have been positive. And while we were going through the meeting, it was stated that there are going to be cases at PSU, and we're just going to try to handle it. So it does concern the town. And I also want to let you know how Durham and Keene have also, because of the university system, those towns have also done ordinance to make sure that there are masks because of all the students that are coming into the town. So that's all I wanted to say. I'm pro-mask. I'm nervous working on campus, but we're all going to try to do the best to help people not get sick and die.
Thank you. Any other residents, Viking?
Yes.
You're up. Go ahead.
Thank you. I appreciate the dialogue and the challenge this all creates. From a healthcare perspective, I feel very fortunate that we have very, very low cases in our community. And that has come at extremely high cost to businesses and particularly to children in the educational system. And I don't know if a mask ordinance is going to work, because there are going to be people who are going to be going to the fences just to prove it wrong and to say, you can't tell me what you can do. But I think the thing we need to do as a community is step up and be responsible and respect the science. And what we've learned over the summer, and unfortunately for Kristen's point, I think it's becoming increasingly clear this germ is spread via aerosols. There are cases of summer camp where it opened in Georgia and rapidly spread throughout the community through singing and chanting, which is unfortunately similar to exercising in close quarters. The challenge is this is not somebody trying to say, I can make you do something or not do something, is what's going to be the most effective thing we can do to have people to join together and preserve our low rates so our schools can stay open and don't close. Because if our schools close, it is a disaster for our community, for our students, and for our business community. And that's not an overstatement. I think there is some suggestion that a mandate may be helpful, but I think there's also humility in doing that, that it's difficult to enforce, but I think it sets an expectation that we're saying, let's be responsible. Let's make sure we keep our numbers low so our children can go to school, so our business can survive, which is going to be a very challenging fall. And that we minimize the numbers of death and harm that this virus can cause, because it can spread like wildfire once it's here. And hearing that there's already a few cases among students coming in when testing we know is limited, just speaks that there's a chance for a rapid spread if we don't have every effort to reduce that spread in our communities, in our schools, in our businesses. So thank you.
Thank you.
How has this gotten out?
Any other Plymouth residents? So I have one that I know is a non-Plymouth resident, and then I know Patrick would probably want to come back on from Plymouth. So we'll go to the non-Plymouth resident.
Yeah, I'd like to say something later if I could. I'm a non-Plymouth resident.
Who are you?
My name is Charles Moriel.
All right, Charles, we'll be right back to you, okay? All right, so we're going back outside to David LaRue. David LaRue.
How are you guys? So
You're up,
All
David.
right. So I'm out here outside, and you guys could probably tell how I feel about this. We have 6 Plymouth residents in this group. Not all of them are on the Zoom call. Another Plymouth resident is trying to get on the Zoom call right now, so make sure to wait for her. But
I got taken off.
Yeah, I got you, Micah. All right. So I know time's not unlimited, so I'll get to the point here. There's a lot of people out here who do not want this. Okay. There's a lot of people out here who were very unhappy to hear that they can't vote without a mask. Okay. The general consensus out here is you don't own the town. We've talked about the college. We've talked about the students coming back. Last Zoom call, hear that? Another car driving by, 2 cars driving by. Talking forces, they support this. They don't support the mask ordinance. So we talked about the college last time. If you already have students who are testing positive, the point of that was so you don't bring positive cases back, okay? My wife is in the nursing program. She is going to be forced to submit to a weekly COVID test. Every single week she has to submit to a weekly COVID test. That's ridiculous, okay? COVID, we have had 1 death under 40 years old as of the last time I checked a couple days ago in New Hampshire, okay? There is a survey, which I think the Plymouth board should look at, or not a survey, but an article written by a Hooksett school board member. And he compared per capita traffic fatalities in New Hampshire versus COVID deaths per 100,000 population in the age groups. So it is an apples to apples comparison. And every single person basically under the age of 60 in New Hampshire is more likely to die in a traffic fatality than from COVID. Every single student that you are worried about coming back to the college and going to the local schools are statistically proven, verifiably, not maybe, verifiably proven to be more likely to die in a car accident on the way to the school than to die of COVID. All right, we are not in the first couple weeks of this. All right, I was, here, can somebody help you get on? Yeah. Somebody help Judy get on. I was open to this when this started. We're damn near 5 months into this, guys, okay? Enough is enough. There's plenty of people out here that are telling you they do not want to shop in Plymouth. They do not want this if they're voters. And there is a movement to boycott Plymouth and take business out of Plymouth. There is going to be major financial change for this town if you guys continue to push this stuff and you don't listen to the people. And it hurts my heart because I've been coming to Plymouth since I was 4 years old. All right. You're forcing people away. You're not working for the people. There's one select board member who's got a head on straight that I know. Okay. Good luck with this because I know you're going to push this through, even though there's plenty of people who are talking about it. Last Zoom meeting, you said, well, we'll consult our attorney with some changes. But even though we had almost, was it almost 100 people on the last Zoom call? About 50-50 for and against. You guys don't really care. You will push this through. And I think it's a shame that Bricks and Bolton are in bed together with their rental house. I think that's a shame in politics, right? You can't be working together to push a mandate when you guys are financially tied. That's crap.
You all set, David?
Yeah, right. let me get the voice of the people out here. Do you guys want this mask mandate? No.
He's gonna just keep. All
I
right.
see Michael Courier.
The next one, I don't see Michael Courier. I
He's
see
right in the middle.
Jessica.
Right there.
Yeah, but does he want to speak?
Jessica Dutile is next, please. Jessica.
Hi, everybody. My name is Jess Dutel.
Mike, you're muted. I'm sorry, Jessica. Mike, you're muted. You'll be next, okay? Sorry. Jessica, go
Hi.
ahead.
Thank you. My name is Jess Dutel. I am a Plymouth resident, and I also work at PSU. And I just want to extend my deepest gratitude to the Plymouth Selectboard members for their work on this mask ordinance. I am in favor of it, and very simply, I think that during this unprecedented time, wearing a mask is an act of love, and it's about caring for our community. And I am grateful and proud to live in Plymouth, which is a community where we care about one another, we protect one another. And I want to, again, thank you for your work and speak out in favor of this ordinance.
Thank you. Mike Courier?
Yeah, I've been a resident here for the last 20 years or so, and I came originally from Holderness. But I've been around a long time, know a lot about the university, the high school I work at as a clinical social worker. And this whole virus situation is something that's just such a question mark. We don't really know how it moves. We've got some ideas on how to combat it to keep ourselves safe. And I think we should take more of a common sense. I don't think this is about, taking anybody's rights and smashing them on the rocks. I think this is more about, we got to make sure we take care of each other and ourselves, because we don't know where this is going to come from. There's a lot of asymptomatic children and people that do not show any signs, and we've got to just get more of a handle on it. I'm for the ban because I think we should have something in place. I think that everybody involved, Mike is out there, mowing lawns and stuff. I don't think there's a necessity for that. I think common sense should rule that. But if a person who doesn't want to wear a mask comes into a store where there are a lot of people where you can't social distance, then I think it's only out of respect that you wear one. I just think that common sense should rule. But if you don't have a mask ordinance, then you can't really do anything. And I know the police are burdened and the fire department are burdened. And I think a situation in town, if you had the ordinance and somebody was just flat out refusing and potentially infecting other people if they have it, then the police can get called and they will respond to something like that. But otherwise, I think it's common sense, have it in place, and just use common sense. I can see both sides of the story. I get it, but this whole thing is a big question mark. We don't know how it spreads exactly. We don't know who might have it. So why take a chance? I'm 67. I got diabetes. I sure as heck don't want to go now. I'm in the fourth quarter of life. I don't want the game to end too soon. So, I like some of the people on the other side of this, this argument, but come on, man, I want to live. And there's a whole group of us that are out there that are very extremely susceptible to it. So I just think we got to kind of come together and use common sense. And I think that will save the day. But I do believe that we should have the ordinance in place. Thanks.
Thank you. All right. Do we have anyone who has not spoken tonight, whether you're from Plymouth or not? I have a Charles Morrill. Are you still on the phone, Charles?
Yes, I'm here. Charlie Moriel, yes.
You're up.
Okay, yeah, I would like to express my strong disapproval for this face mask ordinance. I strongly believe this is an abomination. It's terrible. It's a violation of all kinds of rights. You can actually see, this thing is being so hyped up. They planned this whole thing. There's Event 201. It's all documentable. You can look this up on government sites. Fauci even said they were planning to do this. This thing is being completely hyped. It's about fear, about taking people's rights away. These masks do nothing but make people sick. They restrict your oxygen, and you're breathing back in your own carbon dioxide. That's nothing but bad for people. Our forefathers would be rolling in their graves if they saw what was happening now. And this is on a global level. They're doing this, trying to usher in this new world order. It is absolutely disgraceful. It's disgusting. We need to be stronger and rise above that. Just look around you, observe the facts. It doesn't match anything what the news is saying. It's absolutely horrible, and it's beyond comprehension. And I'm completely against it. Those guys outside talking, I am 100% in agreement with what they're saying. They could not be more correct. This is terrible. I shop in Plymouth, And it just feels horrible to wear a mask. It's just totally restricting, and you just feel horrible. It's not about making people safe. It's about making people basically suffer. It's terrible. And I would, if they did enforce this, I would go somewhere else like these other people. It's terrible. So it absolutely needs to not be passed. I mean, this is just a violation of every human right. Look at it on a global level. They're playing this whole thing out. This thing has totally been planned. It's terrible what's happening. And that's my position on it. I'm dead against it. I know I'm right.
Thank you. Let's see, we have Tonnage Barbershop. You're from Plymouth, I take it?
Hi there. Yeah, my family owns Turnage Barbershop on Main Street. I'm a Rumney resident. I actually also own a business in Rumney. And we are for this mask ordinance for a litany of reasons. One of them being that in the barbering industry, you have to touch people you don't know. You have to be obviously within way more than 3 feet of these people in order to give them haircuts, to shave their necks, to do their beards, to do hot towel treatments. And so this is like, without masks, would be a hotbed for infection. And I think that the biggest concern I know for this business is that we have college kids coming. And while we all want to give them the benefit of the doubt and that they going to be wearing masks on campus, they're going to be wearing masks, you know, in the hub, they're going to be wearing masks in the dining hall. But these are sometimes 18-year-old kids that have never been away from home before, and they don't want to wear a mask. I don't want to wear a mask, but we wear masks. So they come out on the Plymouth Common, they go to Monte Alto, they come to get their haircut, they go to Biederman's, they go to the Lucky Dog, and they sometimes make bad choices, and they do that with or without a mask. And so we, by making a stance, by wearing masks, and by all of us wearing masks, we're showing the college students that this is what we're doing. So you leave campus, you come out here, and you're not wearing a mask, you're gonna look like a sore thumb. And I know that I don't want to put my employees, my sister who's 20 years old, who works in the barber shop, who's a master barber, who probably cuts all of your hair at some point in time. I want to protect her from just getting sick. I want to protect her from getting the flu, and I want to protect her from getting COVID. In addition to owning Turnage Barbershop, I also own a business in Rumney as a seamstress. My business has been totally eviscerated by the virus. I've had to cancel all my appointments. I have had almost 400 bridesmaids' dresses canceled. So I totally understand what some of these people that are concerned about the economy and the impact it has on this. But I have to tell you, it's hard to be a person that works with people, where your business is people. Micah can ride on a lawnmower, and he never has to come into contact with his client. I have to come into my client all day long. And if I can do a simple thing like hold on to statistics, make sure there's a, you know, an even barometer of what the virus is doing so we can keep an eye on statistics, then I'll do that.
Thank you. I have Judy, Plymouth resident. You need to unmute yourself to speak, please.
Hi, my name is Judy Kinney, and I am a resident of Plymouth, and I am here outside protesting the mandate. I don't feel that you have the right to take away my rights as a United States citizen. I understand if it's my choice to wear a mask, I have no problem with that. But to be forced into doing something that I don't believe in, I think is totally wrong. I see that I know that you're doing it for the college, but no, I'm the resident. I'm the resident of this town. I am the one that is paying the taxes in this town, and I should have a voice. And making this mandate is against everything a lot of people believe in, and you're taking away our rights. And that's what I wanted to say. You're taking away my right, my choice as a United States citizen. I pay taxes in this town. And that's all I have to say.
Thank you. Britt, phone.
Sorry, once again, I just wanted a clarification from the select board. Who gets to make the decisions regarding the school? For instance, if the school board for the town of Plymouth or for Plymouth decides that during soccer practice for my 6th, 7th, and 8th graders who are 11, 12, and 13, that they obviously cannot stay 6 feet apart because we're playing soccer, and they are not going to be masked, is that who supersedes? The Plymouth Elementary School Board or the town ordinance? Can anybody answer that for me?
There was
Kayla?
oh, go ahead. Go ahead, Kayla. Kyle, excuse me.
So I think early in the meeting, Britt, I spoke about that specific issue, and my understanding is the select board is allowing the school to follow the protocols that we have put in place for masking both at the elementary school and the high school.
Yeah.
Thank you, Kyla.
An amendment was made and accepted to modify the ordinance.
Thank you, guys. Sorry I'm late.
Is there anyone who has not spoken yet? Whether a resident or non-resident, or whether you're on the phone? We have 18 non-video participants. Anyone need to speak? All right, second round. I'm sure there's people that want to come in one more time. You're going to have 2 minutes. And I guess your time starts now. Raise your hand if you're interested in speaking one more time for 2 minutes. Mr. Courier.
Yeah, I just want to speak to the argument that is used with regard to how many lives are, how many people die from these various things. And, I really don't care about the flu or anything else. I mean, it does its thing. We have some vaccines, but we don't know what this is going on. And why should we allow one more thing that we don't have a handle on to kill more people? It just does not make any sense to me. The argument, I think, is unfounded. And this whole personal rights stuff, I think we all are closer on this than we realize, but some people get pretty excited and they want to fight back thinking everybody's trying to restrict them. Well, I don't know. I think that if we don't have some kind of organized, ban put in place, I think we're going to have bigger troubles than without it. But I don't look at that as taking away my rights, and I'm going to proceed the way I have to proceed to take care of myself and my family. But I think that people are trying to compare this to other things. And why do you want to compare something that actually adds to sickness and adds to health? It's not a comparison. We need to get this thing under control. We need a vaccine, and hopefully in the near future, we'll have something in place. And at that point in time, we'll know a lot more. So thank you.
Thank you. We'll go back to Patrick. You have 2 minutes, Patrick.
My question again, Kathy, I'm just wondering when.
We need to be able to hear you. We can't hear you, Patrick.
I'm just wondering when the board will answer the questions that have been presented in whatever form of communication they've been presented in before this is voted on.
Is that your communication? I mean, the board has addressed the questions and concern that were made at the first hearing, and those are represented in the modifications to the ordinance that you see before you.
Okay. I know Britt asked about like play dates. I didn't hear in answer to that. Kristen Valente about workouts. Again, I just think this is so far reaching and affects everybody in a way that I just would expect some transparency. I know in this past election, when we had some new members elected, that transparency was recognized and the lack thereof. And it saddens me that this continues. Along the arguments of common sense, I just think in an era when we have a segment of our population calling to defund the police, citizens laying in the middle of streets, blocking roadways, I just think we have to be careful about talking about common sense, because what's common sense to you isn't common sense to me. And to follow the science is just absurd. I'll follow your science when you follow my science that says life begins at conception. That being said, I just wondering when these questions will be answered. I appreciate the time and the opportunity to speak. Thank you so much.
I'd like to voice my concern regarding Kristen Valente's issues that she raised. And I'd like to know if the board feels that they could address that.
Yeah, I'm with you, Neil. I actually think that we might consider an amendment on point 2 specifically to address Kristen's concerns.
Yeah, it seems like she's following the governor's guidelines.
So I pulled up the governor's guidelines, and I just wanted to read a quick sentence from that, which this is under the health and all staff and athletes piece, and it says all staff and members must wear a reusable washable cloth face covering over their nose and mouth when in the facility and not actively engaged in workout where a face covering may make it difficult to breathe. And I wonder if there's some way to incorporate the second half of that component into part 2 here. I obviously, we don't want to make it wide open necessarily, but I also think that her point there is solid.
And they are keeping the 6-foot distance, right? Didn't I hear Chris say that?
Kristen is back on. If you hold on, let me just go for it, Kristen. You got to unmute yourself.
Sorry. Oh, the dogs are joining. Thank you, Zach, for reading that. I appreciate that. Yes, Marianne, the distance is 8 to 10 feet, actually. And so how it would be set up, there's very specific guidelines that the governor has set out. So I really appreciated the effort on their part to get that set up. So doing maybe even just a reference to the document for fitness facilities specifically, following the ordinance or the guidelines set out by the governor on June 15th, 2020, for specifically fitness facilities. But it would also carry over not only to, gyms, but like standalone gyms, but what about PSU gyms or any place that there's working out, the high school. And I know that the school, Kyla was talking about how the school could be operating a little differently, than the town, the selectmen, the rules, but just having some sense of rules with the governor, I think would be helpful, because these are very specific. 8 to 10 feet would be. There's guidelines with recommending having some plexiglass when you walk in, having face coverings worn when you're with people all the time. If someone's working out, getting the heart rate up, basically we taking their masks off. So just trying to figure out how people can maintain their fitness and working out during this and being safe. Yep.
Perhaps maybe on that point, could we propose maybe I don't know if it would be a new number or a sub item under that says, whereas the governor's stay-at-home 2.0 program has specific rules and guidance for health and fitness, those will be considered the mandate for this town.
I think that's definitely fair, because they're very specific. I think they're good. They cover everything. I just want to make sure that this segment isn't.
To be clear, they're way more specific than ours.
Well, they are, but I get concerned with the global businesses, like all businesses. So I'm complete support of mask wearing. As you guys know, we're part of SA with doing, the sewing group. But I think, we need to be specific with some of the businesses. There is some verbiage about, going into taxis and government buildings. So I feel like if we're going to be having that kind of information for that there, then we also need to try to talk about some other businesses and how this might affect those businesses. Definitely supportive wearing the mask and go to the grocery store where there's close proximity, where you can't control distances between people. But if there's going into something where it's set up, we're going to have tape on the ground, everyone has their own square, everyone's very mindful and they're following the rules, then just asking for consideration for that setup.
Viking Hedberg, I believe that you had.
Yes, and I hate to bring this up, but and Kristen, I understand your position. The challenge is, I think there's a fair amount of new data that this virus spreads via airborne routes, via aerosols, and that people can be colonized with high levels of that asymptomatically. And when you're breathing heavily, either through yelling or crying or singing, it's spread. And unfortunately, I think also when breathing hard when exercising, I think it can spread much more readily than when you're at rest. And the most recent example is a camp in Georgia where they opened up. They had 12-day, you had to be tested within 12 days. Kids were all negative. And within a week of opening, 76% of those tested had COVID. And it seems the way it spread was in the bunk rooms that kids were chanting and doing what kids do at summer camp. Do we know what that means for your business precisely? No. But I'm concerned that if you're breathing heavily, you're much more likely to aerosolize, and that's going to spread. Now, that's also something your clients are aware that they're taking that risk, and they are not out in the community and they're not in school. And it's challenging also then getting testing. And I know from a communication with Spear today that there's potentially a 3 to 5 day turnaround once the test is done. So it's very difficult to figure out when you have it and who might have it in that environment. I think it's pretty clear it's safe outside. And the dilution is really, really important. So back to Micah's point of, when you're sitting there working as a landscaper, you're very unlikely to spread it to somebody unless you have very intimate contact. But if you're indoors, unless you have very, very effective ventilation, I think that risk potentially is high, but I don't think we have specific data. We have data that's suggestive that that would be true.
Thank you. All right. David and Phyllis Nash, I don't think you've spoken tonight.
Nope.
You're up. You have to unmute yourself, David. There you go.
Hi, good evening, everybody. Simply, this can be a self-regulating. More and more of the businesses that I go into are saying on the door, I'm a private business. I require you to wear a mask. And that's, pretty much stops me at the door. Either I put the mask on or I turn around and go shop somewhere else. So really all we're talking about here is that businesses or governments, places of business or places of government can make their own choices whether they want people to wear a mask or not. And we don't need an ordinance to regulate that. This is a typical government intervention in people's personal lives. The business owners will self-regulate and make their own decisions and be able to protect themselves if they need to. We clearly don't have a problem in Plymouth. I may be speaking out of ignorance, but we're not Texas and Florida, and to have this whole thing going on here for a mask ordinance. And again, as I mentioned last time, this mask ordinance is going to be challenged, and now our town and our taxes are going to be yeah.
So you can keep speaking at 30 seconds.
All right. So we're going to now run into legal fees for an ordinance that really isn't necessary. With the residents and the business owners are going to regulate themselves. Thank you.
Thank you. Any other Plymouth resident? All right, so we're going.
I'm so sorry. I just don't have a raise hand button.
So Kim, you're back up. Kim Croker.
Thank you so much. So I just wanted to kind of circle back a little bit, and I want to express, so I think that there's a couple of different layers to this. Obviously, I think one thing we're worried about the folks who are at most risk. And I think my observation is just being in the community is the majority of folks are wearing masks on their own. And again, what's right for one community isn't necessarily what makes sense for the next community. I think it's important to look at sort of what our infection rates are, what's our population, all that good stuff. And I do, when you put in the mask mandate, I guess I'm just trying to show support. I forget your name, I'm so sorry, but the doctor who spoke about women with trauma, that was one of my first thoughts with a mandate is, if you have someone who experienced some sort of trauma in their life where they were forced to have their mouth covered, what are they going to do, right? You know what I'm saying? And I think that the majority of folks who are wearing masks are kind of taking care of that element. And I also want to clear the air. I don't see the issue of not wearing a mask as like, if you don't wear a mask, I don't think there's no care there, right? I think that we're great at what we've observed. This is a lovely community, and I think there's a lot of great observations. Not the choice not to wear a mask, I don't see that as a way that you're not caring for someone. I think it's a personal choice for whatever you have going on in your life, and maybe that's the best choice. And I think, what makes sense, for Georgia or Florida or Texas might not make sense for Plymouth, New Hampshire, is kind of where my stance is. And if you do the mandate, you are singling out those folks who experience trauma, the folks with, disabilities who can't wear a mask for whatever reason, and you're kind of forcing that to be public, as opposed to just making their own choice quietly and respectfully. And I think, like I said, I think the majority of folks who are, oops, sorry, I'm done. Okay.
You're done. Sorry. Any more Plymouth resident, anything that has not been said yet? I do have one hand from outside for non-resident. Guess we'll go back out there. David LaRue, you're up. Oh, there.
Hey, can you hear me there?
We can. You got 2 minutes.
All right. Yep, 2 minutes. Awesome. I appreciate the time tonight, guys. I appreciate the consideration. And I think everybody's trying to come from a good place, but I do believe you guys are asleep at the wheel. So I'm just going to cross the street right here, and I'm going to show you all the people that are out here who do not want this. As I said, there's about 7 Plymouth residents now. A couple of them got on and spoke because I advocated for them to get on and speak as residents and taxpayers. But we've got over 30 people out here now, which is more than you have on this Zoom call. All right, it's pretty disheartening to me that you guys will not listen or even consider this. Right, this was a done deal before you guys started, and I really think that's a shame. And I think you guys are worried about the college. And the bottom line is America was founded on individual freedoms, individual liberties, and that sometimes death is not the worst of all evils. Live free or die. You see that cannon that's in front of your town office right there? That cannon was captured by General John Stark, a great American veteran and a great American hero who is known to be the namesake for our live free or die motto, okay? You guys forget our history, you forget our heritage. And the last thing I'm gonna say is, I heard this great quote: if you claim to stand for the minority, and you claim to stand for the oppressed, and you claim to stand for people who are underprivileged, but you do not stand for individual rights, then you cannot claim to stand for the minority. Because that person right there, that individual, he is the smallest minority. That person is the smallest minority. That person is the smallest minority. The individual is the smallest minority. And I really think you guys have lost sight of that. We're all adults and we can all make our own choices. You guys want this crap? No! Good luck, guys. You're going to need it.
Thank you. I think we've heard from everybody that wanted to speak at least once or twice tonight. So I'm going to give it back to the board. Bill?
Thank you. So,
Close the hearing.
I'm going to, John, you're way ahead of me. So I'm going to close the public hearing. It's now 7:28. And I think we've already determined that, actually, can I take a motion to close the public hearing?
I move that we close the public hearing.
Thank you, Neil. Neil moves. Is there a second?
I'll second.
Hi. Mary Ann, seconds. So, Mary Ann, your vote.
Aye.
Zach?
Aye.
Neil?
Aye.
John?
Aye.
Bill? Aye. The public hearing is closed. And we've discussed the fact that there is a change to the verbiage, we added that amendment regarding the schools. And any other changes suggested?
Well, I think Zach was suggesting that we might be able to incorporate part of the governor's policy on sports and fitness type activity.
Yeah, I mean, his is obviously a recommendation, so we would want to state it in our policy as the policy for that particular business group. But it does seem, I don't know if you all have read through it, but I took a moment to just give it a brief browse while Chris was talking, and it is pretty thorough. You know, it talks about 6 feet of distance. It talks about face coverings, you know, in most reasonable situations. And certainly my perspective would be, you know, there's a bunch of guidelines there. Let's lean on ones that are already more thorough and more tailored to that specific business area.
Yeah, I agree with that. I think if we have that verbiage pointing to the governor's requirements, recommendations, I think that works for me.
I may have to, well, I think I might accept Viking's compelling language regarding the nature of gyms without masks, but it seems like we're ready for a motion. Is there a
Zach,
motion?
you want to make a motion?
If I have to move, I have to actually like write this verbally, which is slightly challenging. But I move to amend. Wait, should we add it as a number, or should we add it to the 2? Should we adjust 2 or add a new number? What's better before I make my motion?
I think you'd probably want to amend 2 because that's entering any business.
Okay, so I move to amend 2 to add where the governor's stay-at-home 2.0 recommendation has more specific guidelines for health and fitness. Those will be the rule or the rules for the town.
Okay.
Second.
Zach moved and Neil seconded. Any discussion? Seeing none. John?
Aye.
Zach?
Aye.
Neil?
Aye.
Marianne?
Aye.
And I'll vote aye as well. So the majority, it passes. And so as amended, any other changes or revisions?
I feel like there's 2 that we should at least discuss, and I don't necessarily have a proposed amendment, but I would feel bad if we didn't discuss them. I think that Britt came with some interesting points. Specifically, I want to discuss 5. The way we have this written, I certainly never implied that if a neighbor kid is in a house of another person in town and they're maintaining distance and all of these sorts of things, that somehow our ordinance would be reaching into, you know, individuals' homes and suggesting that, you know, under those conditions we're applying some rules. That wasn't my understanding of this, and I'm a little concerned if that is more broadly what we're trying to do here.
Well, we know this was clearly, you know, out of concern for some of the off-campus rentals, hence the 2 units, as opposed to a single-family residence.
Well, that's fair for the first half, but what about after the period in that first sentence? Then it says persons at large social gatherings within the limits allowed by the governor's emergency orders, which would mean any gathering of 10 or fewer people.
Didn't, hold on a second. Trying to find it, so.
Sorry.
Bill?
Yeah.
I'm thinking, I mean, we can set it up where the select board can get together here in person, get this final draft and sit and talk about it, have it on TV. But, you know, we're looking, we're not even going to have a draft, it doesn't look like tonight, of what it's going to look like to even vote on it. And I think we need to have you know, if we're going forward, we need to have a select board in-house sit down, have it televised, and be able to hash this thing out.
So
That's
Jen,
my
I think
opinion.
that's what we're doing right here. And I think, you know, we've got, I mean, we're, you know, seem to be going forward with the amendments to this. And I think it's probably a critical time actually to either decide or not, you know, at this meeting. So, you know, not unless the board feels otherwise, I think we are close to at least language changes that would be acceptable for the board to say yay or nay on.
I agree with you, Bill. I think we're close.
Yeah.
Surprise.
Just quickly on 5, am I the only one who's reading that way, or can it be read to be maybe a little bit deeper reaching?
Zach, is there a number that's given in the governor's order, 50 to 100 for large gatherings?
Right, good question.
So the governor's order says any gatherings of 10. Seems real small to me.
Oh, I don't know. That seems like a lot.
Yeah, it does.
It does, but you know, at the same time, if this says within the governor's mandate, you could have 4 people in a house and suddenly everyone has to mask up.
Steve, you're still here. Do you want to comment on this at all?
I'd be happy to comment on it if the chair would like me to.
Sure, Steve, go ahead.
Well, my whole thought process is I do read it the same way you're reading it, Zach. And I caution you guys all for mandating people to do certain things within their own household. And that's exactly how I'm reading it. That's the concern I have. I've already expressed that concern once. You can regulate what people do in public spaces, but once you start going into people's homes, you can't regulate what they do, even if it's an apartment. It's against the Constitution.
Does that include inside and outside, or just inside?
Well, the way it's worded also, it depends on what definition you're using for communal spaces and common areas. To me, that could be inside or outside, and we do have several apartment buildings in Plymouth that do share common spaces inside, like kitchens or living room spaces or stuff like that. And again, I would caution the board for regulating what can be done in somebody's own home.
This has been reviewed by our lawyer, and Radigan did, you know, accept this language. And
I get it, but working with lawyers for 26 years, they're not always right.
That's true.
All right, so here's where I'm at, and you all can happily either vote me down or go with it. But I would move to amend Part 5 to strike the second sentence in its entirety. For anyone who's following along, that second sentence reads, persons at large social gatherings within the limits allowed by the governor's emergency order shall be required to wear facial coverings at any time they cannot maintain 6 feet social distance separation.
So does that mean that we're going to allow large social gatherings?
No, because the governor's
Right.
mandate already doesn't allow them. Right? So we just fall back to the state mandate at that point, and we're not adding an additional layer here.
Well, isn't that what we're saying? Within the limits allowed under the governor's emergency orders. Isn't that in effect what we're saying?
We are saying that within those limits, they should be wearing face mask coverings, which is an addition to the governor's order. Right, the governor's order says you're not allowed to have a gathering more than 10 people. And what we're saying is that if you're within the governor's recommendation of 10 people, you also need to be wearing a face covering.
I guess I read it the other way.
This is where the lawyers make all their money.
Yeah,
Mr. Chair, point of order, please.
Sure.
If you're all confused about it, we're the ones that have to enforce it. How the heck are we supposed to know what to do? It has to be crystal clear for everybody.
I think maybe we should strike that sentence.
That's what I moved. I was looking for a second.
Okay, you got it. Now we can discuss it some more.
All right, so, moved by Zach, seconded by Neil, or vice versa. Who moved it anyway?
I moved.
Acted.
Zach did.
Okay, any discussion or further discussion?
No.
Mary Ann? Were you-
Nope, I'm good.
Okay. Okay. Seeing no further discussion, then Mary Ann, your vote?
Aye.
Neil?
Aye.
John?
Nay.
Zach?
Aye.
And Bill? Aye. So that's sentence with strict, whatever, out. So, any other further discussion?
I'd just like to add a personal note. I grew up in Plymouth. I'm a lifelong resident of the town, and my dad was a captain in the 10th Mountain Division in World War II, and after that he practiced medicine in Plymouth, and he was a Grafton County deputy medical referee for 30-something years, and there were many times that I saw him deal with epidemics and mass public health crises, and he always took swift and decisive action. And I think we've been very fair about listening to everybody and evaluating all these concerns. And I think we need this.
All right, thank you, Neil. So, any other comments, or is there a motion?
And make a motion, we accept the ordinance with the changes.
Second.
Okay. Mary Ann moves that. Zach, you stuck a second in, right?
No, Neil didn't.
So, Neil, your vote.
Aye.
Mary Ann.
Aye.
Zach.
Aye.
John.
Nay.
Bill. Aye. The ordinance passes. Very good.
Start tomorrow.
Takes effect immediately, Bill?
It does.
Where do we need to get this posted?
That's a good question, Kathy. Where is it going to be? Well, it's going to be posted on the web. It's going to be posted where else?
Can I ask a question?
Sure.
How long does the ordinance last for? Just until the select board deems fit?
No, it's upon either, well, actually, primarily, yes. You know, the governor, you know, may decide to stop his emergency order. There may be some issues specific to our town that may require continuation until, you know, we decide to, you know, pull the plug as well. We would not beat the governor to the punch. You know, he would be the one to call it, though.
Thank you.
Okay. Well, all right, Kathy, as far as like posting it, it's going to be,
Yep. The website, the recycling center, the library, Hannaford's. And on the front door, and John Radican also suggested putting it in the newspaper.
right. And just one, it wasn't just two postings, something like that, but
Yeah.
one newspaper and the web or something would be adequate.
Yeah, but we always post it in the other areas.
Yep. All right. Well, thank you all for your help with this.
Thank you.
Thank you, Select Board.
And now, to kind of put a pin in that, let's talk.
What happened, Bill?
If only we had broadband internet.
Ouch.
Bill pulled the plug.
And broadband internet, yeah.
There.
There you are, Bill.
Yep, I'm back. You knew I was going to be back. So, and you want to bring up the Denron Plumbing and HVAC thing?
Yeah, we have a purchase order here to be signed for $7,242.28. This is for replacement of the furnace HVAC parts, cleaning, labor, including travel for the town hall building. And this is part of the $100,000 that was put aside out of the bond for the town hall.
Okay. Is there, are there any questions from the board? Seeing none, is there a motion from the board?
Sorry, I was being a
So
little bit
moved.
slow. I had a quick question. This comes out of the general building maintenance and repairs town hall budget
Yes.
line item from the bond.
You have a motion.
Yeah, we had,
I'll second it.
very good. Okay, we got a motion. Marianne moved, Neil seconded. Any discussion? Seeing none, Marianne, your vote.
Aye.
Neil?
Aye.
Zach?
Aye.
John?
Aye.
Bill? Aye. Motion passes.
Thank you.
Thank you. All right. Any more items?
Committee reports, if you've been to any.
We had those other things as well, but we're going to address that at the next meeting.
No, there's only, actually, you only have two. You have Brian looking for a policy for the use of the common, and Zach had citizen noise concerns. Steve LaFaves is going to wait until the next meeting.
Okay. All right. So any committee reports?
This isn't a committee report, but I noticed today that the townwide yard sale has been canceled, and figured that for just sort of public information, we should just mention that that is the case.
Okay. Thank you, Zach. Any other? Neil?
No.
Marianne? Oh, Zach's got something else, but
School board meets tomorrow to theoretically approve their reopening plan for the elementary school.
okay. John, do you have anything?
No.
All right.
I think the coyotes have my house surrounded. My dog's going crazy.
Is that your report, Neil?
Yeah.
Okay, that's a good one.
For help.
Are there any public comments?
Just like to chime in quickly and again thank the select board for taking decisive action tonight. I think that if we were to wait any longer, certainly if we were to wait for the students to arrive before we were to try to make amendments to this, that we would end up facing a too late situation. So again, I commend you guys for maybe taking a risk here, but it's like you said, it's possible to modify and amend things as we go and help it better fit our community. But just general gratitude here. Thank you guys for putting public health first and for hearing all of us tonight. Thank you.
Thank you, Michael.
I got a back channel clarification. I said the school board meeting's tomorrow. The high school board meeting's tomorrow. The elementary school is on Wednesday, and the high school's already approved their move-in plan. Elementary school, they're discussing it again on Wednesday. So anybody following along, I was off by a day, sorry.
Okay. So therefore, is there a motion?
I move we adjourn.
All right, is there a second?
You guys asked for any other public comment.
You have a motion on the floor.
Yeah, we do. We got a motion to adjourn. David, I'm sorry, but
Okay, then you shouldn't ask for more public comment. I guess you guys just messed up there. So I hope you guys can see.
so Neil moved. Is there a second?
I'll second.
All right. Zach, your vote?
I'm going to vote nay just because I would have liked to have heard the public comment.
Neil.
I'd rather hear their public comment.
Okay, in that case, nay as well, and therefore the majority indicates that David LaRue can make his public comment.
David?
All right, they're going to let me speak. Hey, can you hear me? Can you hear me?
Yep.
Okay, awesome. Thank you, guys. Well, I'm sorry to hear that the motion passes, and all these people out here also feel that way. You know, I don't speak for them as individuals. I speak for them as citizens of America. So we have this group has grown from me, one person, to over 30 people who took time out of their day to come out and support this right now. We got people on vacation. We got people who are involved with me, and we got people who are just driving by and liked what we were doing, okay? So the movement against this is going to continue to grow, guys, and I'm sorry, not just from me, just from everybody. People do not want this, okay? So do you guys have anything to say to the select board? Yes. You took away my rights. There you go. You took away our rights. You silenced my voice. There it is. I mean, I got 35 people out here, so I guess I could stay on for a while, but I'm not gonna because you guys are done.
Okay, so therefore, is there another motion?
I move we adjourn.
All right, is there a second?
I'll second.
All right, Neil moves, Zach seconds. Mary Ann, your vote.
Aye.
Neil.
Aye.
Zach.
Aye.
John.
Aye.
Bill. Aye. Well, thank you.